I'm not doing this face on purpose, guys. This is what used to happen every time I would go to take a selfie. I'd subconsciously had this not cute habit of pursing my lips, which caused my chin to shorten and my lower face to look tense, which caused this dimpling. And it was not a very attractive look. And in this pic on the right, you can see that my chin looks so much better, and that's because I treated the area with Botox. Turns out a lot of people don't realize they're making this face, and a lot of people don't know that you can treat this area with neuromodulators like Botox and Dysport. And since our chins play such a crucial role in facial balance, attraction, and youthfulness, you're gonna wanna watch this video because I'm gonna show you what it can do for you and how it works so that you can determine if you're a good candidate. We'll look at before and after photos, and you're gonna see why this is the perfect treatment to go along with chin filler. And we're starting right now. We spoke about the importance of balance and proportion in the chin filler video, and we learned that attractive chins are well balanced in relation to our lips, in particular our lower lip border. Well, in addition, chins that look smooth, that are in a relatively relaxed posture, also look more attractive than if they look scrunched up and tense. So we all have a mentalis muscle that's a paired muscle located at the tip of our chins, and it's named so because of its association with emotional and thoughtful facial expressions. This muscle allows us to pout, protrude, and elevate our lower lip, and it sometimes results in giving us poudrange, which means chin dimpling. The dimpling to our chins is the result of this muscle raising our lower lip, and it can be seen at rest or with talking. And a lot of times people are unaware that they're making this face, and it can be present in all ages. And you may be thinking, but isn't this normal to pout and get dimpling? Children pout and get dimples, but it's not only about the dimples, because when the muscle contracts, it also causes the chin to shorten and look tense. So the question is this look making your chin look less attractive? And yes, I believe there are instances in which it can make someone's lower face look less attractive. In people with underprojected or recessed chins who have a very active mentalis muscle with visible tension, and notice, this visible tension is seen here in her at rest and while she's talking, they're great candidates for this procedure. Now, this patient is also a great candidate for chin filler or a chin implant, but that's unlikely to address her chin aesthetic as a whole. Because even if someone gets chin filler, which would elongate and project their chin forward, this muscle would still be contracting, contributing to the appearance of retrusion by pulling the chin up and in, creating an undesirable contour, almost working against the chin filler or chin implant, because each time the mentalis contracts, it shortens the chin, causing tension to the area. Now, as we get older, there are a few signs of aging that happen to all of our chins, no matter if we have an underprojected or recessed chin or not. It happens to all of us. That orange peel appearance gets more apparent because of the loss of subcutaneous fat and dermal collagen. We also lose bone and our chin shortens, and the combination of this bone loss and contraction of the mentalis muscle causes this crease or groove between our lower lip and chin to deepen, and this crease is known as the mental crease. All of this leads to our chin scrunching in, decreasing the length, projection, and fullness of the soft tissue of our chins. Treating the mentalis muscle with neuromodulators like Botox or Dysport does a few awesome beneficial things. It decreases chin dimpling because it relaxes the muscle, as you can see here with this patient. Her chin looks more rested and less tense when she contracts. It can slightly elongate your chin, and it can alter the position of your chin, giving it an ever so slight projection. It can also lessen the mental crease. Botox really improves the chin aesthetic by relaxing and slightly altering the position of the pagonian, which is the most anteriorly projected point on the chin right here. You can see in this patient, there's a little more fullness here to the pagonian area after treatment to her mentalis. Every time I treat my chin and the Botox or Dysport starts kicking in, I feel like it gets so beautified because it's like anchoring it into a more relaxed and attractive posture. All of these reasons make it a great adjunct treatment to do with chin filler. And if you don't know if you're a good candidate for chin filler, watch this video. But I just want to make something very clear. Treating your chin with Botox is not going to give enough projection. If your chin is recessed or underprojected, then you'd really benefit from chin filler. And Botox the mentalis is a great adjunct treatment to do with your chin filler because it'll make your chin filler last longer because it relaxes the muscle, preventing your chin from moving up and in, which will be working against the chin filler. So who are good candidates for Botox to the chin? Anyone who is bothered by their chin dimpling. If you have a chin that's underprojected, which means your chin sits back further and your mentalis muscle's active, you're a great candidate. If you have an active mentalis muscle, it can help to slightly elongate your chin because when that muscle contracts, it moves the chin upward and in. I love the elongation it gave my chin by relaxing my muscle. It helps soften the mental sulcus, as you can see here in this patient after her treatment with Botox. But again, it doesn't take the place of filler. As we get older, this mental sulcus deepens and will likely need to be injected with filler. How much does it cost? This treatment is very cost effective because it doesn't take a lot of units of Botox compared to other areas of the face. Units generally range from about 4 to 15 units. And I get a lot of comments in the comment section sometimes or DMs on Instagram asking how much it's gonna cost someone. Unfortunately, I'm not gonna be able to tell you how many units you're gonna need because it's customized to your chin size and how strong your muscle is. So I'm not gonna be able to tell you how much it's gonna cost you, but it's generally much less expensive compared to other areas of Botox. And that's because we don't need as many units. How long does it last? It can last anywhere from around 3 to 4 months or longer. Sometimes after treatment, especially in people who have very strong mentalis muscles, they message me either 24 hours to 48 hours or so after treatment saying they have this weird bulging or ridge to their chin, which sometimes goes away in a few days and sometimes doesn't go away after their full effects of Botox have kicked in. So if you still have this weird bulging, then you probably need more Botox so that you treat the muscle to its entirety to prevent any unevenness and for best results. I don't know about you guys, but you may think that you can just try to train yourself not to make certain faces anymore, like whether it be the model pout. I can still pout, right? But I can't pout to the point where my chin gets as tense as it did before where I was forming cobblestone chin. Anyway, if you want to learn how powerful your lower face is in impacting your beauty, make sure you watch this video.